In this study, we looked at population-based sample of people who have markers of small vessel ischemic disease to figure out what risk factors through cardiac as well as metabolic risk factors were associated with progressive small vessel disease. Interestingly, what we found was that whether you had midlife hypertension or current hypertension, both of those risk factors were associated with progressive small vessel ischemic disease. I think it's particularly relevant in light of the SPRINT-MIND trial results that were just released that do show that judicious blood pressure control can reduce the risk of not only cardiovascular disease and stroke, but also mild cognitive impairment and probably dementia if they look long enough. This is particularly relevant in light of those trial results because what we're finding also is that it's not just hypertension at the time of enrollment, which was mean age 68, but in our study, it was midlife hypertension, so going back to age 40. And so truly it shows that the blood pressure over the course of a lifetime kind of give us our metabolic fate and our brain health. So the clinical takeaway is to really key in on blood pressure. To this day, blood pressure remains the single most important modifiable vascular risk factor, and I think controlling blood pressure over the course of a lifetime is the best thing that you can do for brain health. I think we can have academic arguments about methodological limitations. I think we can talk about what's the best number. Is it 140 millimeters mercury? Is it 130 millimeters mercury? The fact of the matter is the practical real-world implications of this is that we need to get our blood pressure lower as a population so that we can age appropriately.